Hi, I'm Naomi Schumann. I volunteer with CSPC, and I'm here with Naveed Aziz, Vice President, Research and Innovation at Genome Canada. We want to thank Genome Canada for being such a big supporter of CSPC and for your support as well. So, to get started, can you tell us more about precision healthcare or precision health and how it differs from healthcare?
Yeah, thank you, Naomi. So, precision health really takes into account a person's genetic makeup, their lifestyle, their environment, to healthcare approach, right? It's very different from our traditional healthcare approach, which is kind of one size fits all. Precision health really takes into personalized angles of people, as I said, genetics and the environment, to not only predict disease, but also manage disease and come up with therapies and remedies and drugs for them. So in that way, if you focus mainly on a person's individual profile, it helps to get more targeted therapies, saves the healthcare system a lot of money because there's no trial and error, and saves a lot of lives, most importantly, because you can really get to the bottom of the disease, the reason for that disease, and targetedly try and cure that. So it just makes a huge difference in kind of population level health.
So you've told us in general about precision healthcare. Can you give us an example of a story where precision healthcare has been really effective in either predicting a disease or in treating a disease?
Yeah, I can kind of give you one generalized example and one more specific one. So in generalized, in Europe, for example, they've started to look at population stratification of disease. For example, they are now trying to, based on people's genetic profiles, they're trying to see when and how testing for certain diseases should be done, how they can separate people into different buckets who needs more earlier attention. The example being, for example, in breast cancer case, some women are more vulnerable to breast cancer based on their genetic profile, and some are not. But as a general policy, for example, in Canada, everybody starts to get these exams at age 40, right? And some women really need to be looked at or examined much earlier and tested much earlier to catch the disease early and make sure that the disease can be remedied that way. Some women who do not have the potential to have large potential for cancer could be then treated or tested much later. So that's just one example of how you can stratify the population in, again, saving healthcare money, but also focusing on people who need help more. The other specific example is on kind of the rare disease side. So rare disease, as the name implies, is a disease of people who have, a few people as compared to the wider population. But a lot of the time, rare diseases stay undiagnosed. For years and years, patients have these disease or health odysseys where they're going from clinic to clinic, from test to test, to figure out what actually is the problem. We forget about therapy. Again, in precision medicine, if you look at somebody's genetic profile closely, you can identify a rare disease that is specific to them, then a therapy can be applied to that. So these are some examples where precision health can really help the population and save lives.
So what you're saying is in some cases, precision healthcare can be used not to just treat symptoms, but to actually treat the disease itself.
Correct, and diseases and essentially catch it much earlier than later. So you're not looking, as you said, like symptoms, but you're catching the disease much earlier.
Great. So I'm assuming that policy plays a big role in advancing precision healthcare. Can you tell me more about policy's role here?
Yeah, I mean, policy is absolutely critical to precision health, and we are at a policy conference, so it's very appropriate to talk about that. I mean, it's really, policy is the way precision health will be employed in places. The infrastructure to actually practice precision health will be deployed in places. Policy can force infrastructure application in certain areas, in remote areas, in remote populations. Policies is important. Policy is also important, and we can talk more about that. But for precision health to work, it's really underpinned by data, large-scale data, and data privacy is another issue that. So policies can also control or have a kind of way of figuring out how we practice privacy in precision health. Policies also. So there's always this tension between innovation and kind of control, right? Innovation runs away because it's innovation, and if it's not running away, it's not really innovation. But then there are policies that control the innovation, sometimes too much, sometimes too little. So that balance of what policy allows innovation to do and what it doesn't, right? And again, we can talk about it with their specific examples of gene targeting and of gene therapies that are kind of policies controlled by policy. So policy plays an absolute huge role in every aspect of deploying precision health in the communities.
So what are the main policy challenges facing precision healthcare in Canada?
Right, so I kind of alluded to it a little bit. I think precision health we have to make sure that precision health, when it is deployed in the communities, is equitable, right? We have to make sure that it's not just about precision health being available only to the people who can access it, the rich people or people in the cities. So in Canada, the way the healthcare system works, it's federally funded, but it's provincially administered, right? So the crosstalk across the provincial borders on how these different policies will apply across the country it's a huge challenge for Canada. And we have to make sure that different provinces have similar or same policies in terms of deploying precision health in the community, and in terms of sharing data. I mean, sharing data, again, as I said, precision health is really underpinned by large-scale data. And when it comes to data, there's privacy issues. There's privacy issues. Policy comes in straight away as to how that data can be shared. When you talk about equity, we have to make sure that precision health policies are in place that allow precision health to be deployed in rural communities, for example, for indigenous communities. Then you have to also think about how this can be deployed in indigenous communities. How do you take the technology to the community rather than expecting the communities to come out to the cities? Again, policies and frameworks that can mandate the deploying those technologies is important. So there are some challenges in Canada just because we are such a large country. We work across provincial borders. Our healthcare systems are largely very different. And those need to be tackled. Equity is another area where precision health, as I said, is important to deploy even within cities and population in communities that are not well represented in our kind of healthcare system or in our data sets. That's important. So again, policies around how we make it more equitable and inclusive. I think that's some of the challenges that we're still working on.
So can you tell us more about what steps Canada should take to strengthen its policy framework and keep up with global and international developments?
Yeah, sure. So I think before I kind of go into some steps, a couple of things I would say. I think getting the policies right, especially around the privacy and the equity piece, are absolutely essential and critical. Reason being that for precision health to work, it's a population-wide, population-level technology, and for that to work, we have to have public trust. If there's no public trust, you can't share data. If you can't share data, it will not work. Again, for precision health to work, the data has to be shared. If you don't share data, then it really becomes an individual person's genetic profile. And if you don't have the ability to compare it with the larger population, you can't really draw in for any kind of analyses or insights from it. So data really needs to be shared. But then privacy also has to be maintained. So I think some of the things that we have to work on in Canada especially, but globally people are working on it as well, is to make sure that we come up with policies that not only protect the patient's privacy, but rather than just locking it behind a closed door, allow it to be shared not only nationally, not only provincially, but internationally. Again, because precision health is a large data technology, you can imagine that sharing the data with international communities and international countries makes it even stronger and more powerful. So if we don't have policies that are in line with international regulations, then we will not be able to exchange those data sets. We will not be able to exchange those technologies. So we want to make sure that not only we have policies that puts patient or the Canadian first in terms of privacy, but are set in a way which allows us to share data nationally and internationally.
Can you just elaborate on whether there's an issue of Canada developing these policies in a timely manner?
Yeah, so I kind of hinted to it a little bit about innovation running away, and that's kind of the nature of innovation. But as Canadians, we are always extra cautious. We're extra cautious. Some of the other countries like the UK, the US, now even Australia, some small countries, Denmark, Singapore, they are ahead. And one of the reasons they are ahead is that while they are being very careful, but they're not as cautious as we are here in Canada. There's a lot of red tape. We don't need to cut corners, but we do need to cut some red tape, right? So inherently, Canadians are way too much cautious in kind of coming up with these policy and deploying them. We really wait for others to do it, and then we say if it works, we will do it too. And I think that culture needs to change a little bit. And that actually is, we're at CSPC, and if you've attended some sessions already, that's kind of being a theme around innovation in general in Canada, that we need to be a little more aggressive in taking a little bit more risk in doing more innovation. And in this case, we have to be very cautious because it's privacy, so it's not about taking risk, but it's really about cutting some red tape and accelerating some of these. Precision health is coming, right? It's not about if, it's about when. And the quicker we can solve some of our issues, there are a lot of them, not all of them are policy, but a lot of them policy related, the quicker we can issue, the quicker we can deploy precision health in the clinic, and the quicker we can apply it in the clinic, the quicker the community can benefit.
Thank you. So, in your opinion, what is the value CSPC plays?
Okay, so I've been involved in CSPC for over 10 years now. I have volunteered for CSPC. I have chaired committees for CSPC. I'm right now on the board of CSPC. I can tell you that CSPC brings a lot of value in the kind of science policy space. It not only kind of provides a platform for people to engage and meet, but it also provides a platform where people can practice, and really brings researchers, policymakers, government people, provincial government, federal government people, students, all of them together. So it really kind of plays that role. But something that's really close to my heart is the talent building. So I have seen colleagues who have kind of come into or been associated with CSPC have made careers out of science policy because they've been involved with CSPC. This conference is a great example of people who want to practice science policy, and people are already practicing science policy, and people who want to understand, bringing them all together for 3-4 days under same very large roof, letting them interact, letting them communicate. So to me, the talent building piece of CSPC is, I definitely would say one of the only places in Canada that provide that kind of space for people interaction, and that's absolutely huge for Canada.
Thank you so much for sharing your insights as part of the interview series. I hope you enjoy the rest of the conference.
Thank you very much, and thank you for having me.